Good evening. Welcome everyone to the Heart Health Lecture Series, which is part of our Center for the Prevention of Cardiovascular Disease. Next slide. My name is Dr. Dennis Goodman. I'm a clinical professor of medicine in the Department of Medicine and Cardiology at NYU Langone Medical Center, and I'm Director of Integrative Medicine at NYU. Next slide. So I want to just tell you all how you can ask questions today. It's really important that if you've got a question, you just click on the Q&A box, put your question in. I'll be fielding all the questions and we'll get them answered by our expert at the end of the lecture. Next slide. So we're very proud of our lecture series, and I always like to alert you as to what's coming up. And you can see that we have the next 3 of our lectures are coming up in January. If you go back one, and the first one's going to be anti-aging strategies and treatments. What's the hype? On Thursday, January 12th. We've got Women's Heart Health Month in February, and we're going to be talking about that and understanding your risk. And it's very helpful for men as well to participate in this. Clearly, we'll be focusing on some of the differences between men and women, but we obviously invite men to be listening as well. And that's on Tuesday, February 28th. And then in March, we have high blood pressure, hypertension, all you need to know to prevent a heart attack and stroke. Next slide. If you go back one, Anya, I just want to point out that if you want to sign up for these lectures, there's our address at the bottom, nyulangone.org/heart health lectures. Next slide. So we've been doing this since 2015. We're well over 50 lectures on different topics. And you can see some of the topics here: the microbiome, a healthy weight, sleep, blood pressure, diabetes, osteoporosis, stress, aspirin, hormone therapy. Lectures mostly revolve around what I consider the 4 legs of the stool, which are how do you stay healthy? I'm very focused on prevention. And the most important things that you can do are eat a healthy diet, so that's nutrition, exercise and flexibility, stress management and sleep. And these lectures, as you all know, are focused very often on these 4 legs of the stool. Next slide. So the lectures are now being recorded, and you can actually listen to lectures that you might have missed. Tonight's lecture will be recorded, and there's a lecture library on YouTube. And I will give you the address on how to find that very shortly. We've now got over 29 videos on YouTube and over 85,000 views. Really terrific. And Anya, thanks for making that happen. Next slide. So here's how you keep in touch with us and how you can get onto how you can get a link to YouTube. You can use the website, you can use email, or you can use our Twitter account. Next slide. But here's the most helpful and I think easiest way to get to us: nyulangone.org/heart health lectures. That's the website. And if you go onto that, you'll see all the links that you need for signing up and for what's coming up. Next slide. It's now my pleasure to introduce our guest tonight, who is an absolute expert in his field, and a real pleasure to have with us tonight. He's an outstanding speaker and teacher, and his name is Dr. Adam Brown. He's an adjunct assistant professor in the Department of Psychiatry at NYU Langone Health. He's the associate professor of psychology and vice provost for research at the New School. He's an expert on developing programs for mental health and identifying factors that contribute to mental health risks. Excuse me. He's a consultant for the UN, UNICEF, and Amnesty International. He's received many grants and his work has appeared in many peer-reviewed journals and book chapters. Adam, welcome to our lecture series. It's an absolute pleasure to have you. As I told you, it warms my heart to have somebody that's so focused like you are on one of the arms of the stool I spoke about, which is stress management and mindfulness. Your topic is yoga, mindfulness, and meditation. Is it good for your heart? I did put an exclamation mark because I believe it is, and I'm sure you'll be able to persuade our listeners exactly why it is. So welcome, and over to you.
Thank you so much, Anya and Dr. Goodman. It is a pleasure to be here. I know there's a lot going on in people's lives, and just being here gives me a sense of optimism about the way people are thinking about caring for themselves and hopefully taking this information back to your communities, to your families, to your loved ones, to spread this information as well. And thank you very much for that warm introduction. I'll just say very quickly about myself before we get started. I'm a clinical psychologist, and most of my work over the last few decades has primarily focused in the understanding of stress and the way it impacts our minds and our bodies. And I'm grateful to be here because in many ways, we've just started to explore the deep connection between the way stress and different interventions can really promote and protect us from stress, and can promote healthy lifestyles, if we integrate and begin to cultivate different behavioral strategies. And so we're going to be focusing on a couple of things, including yoga and mindfulness and meditation. There are obviously other things that we can be doing in terms of therapy and other exercises that are great for our heart. But tonight, we're going to focus on these three. But if there are more questions that you have, please feel free to put them in the question. I also just want to say that whenever we're talking about mental health, there is still sometimes a bit of stigma around the issue. I will leave you with my email address at the end. So if there's a question you're thinking about, if there's something you want to ask, but you don't feel like this is the right context, go ahead and send me an email, and I will get back to you as soon as I can and try to give you more information. So thanks. Let's go ahead and get started. If we can go to the next slide. Again, thank you all for being here and making time and giving us your attention. I hope tonight's presentation is helpful. We can go to the next slide. A little bit about where we're going to be going tonight. First, I just want to bring us all onto the same page and talk a little bit about definitions and terminology. I know we use a lot of words like stress and anxiety and resilience, but what exactly do we mean by that when we're thinking about how we're caring for ourselves and others? And then I want to just jump into a little bit of the state of science in terms of how mental health and taking care of our mental health is good for our cardiovascular prevention and for taking care of our heart. And then we're going to go even deeper into mindfulness and yoga. And here we're going to, that's where the rubber hits the road, so to speak. Let's talk about very simple practices that we can do every day that hopefully don't take a lot of time, but ultimately, if we do them, will pay off in terms of those preventative strategies. Okay, we can go forward. So Stress 101, the science of stress, anxiety, and resilience. Let's please go to the next slide. So what is stress? I'm pretty sure that everyone on this call tonight uses this word constantly, especially if you are a New Yorker like me. There's always a lot of things that we're juggling and attending to, and it's not uncommon to ask someone how they're doing, and they respond, "I'm pretty stressed right now." Now, mental health professionals like myself like to break the concept of stress into, I would say, like subcategories. And this is, I think, is important when we think about how we take care of our mind and how we take care of our body. So rather than thinking about stress as this all-encompassing idea, let's break it apart a little bit. On the one hand, we have stressors all around us, which unfortunately are often out of our control, and they kind of come out of nowhere, and there's little we can do about it. On the other hand, there are our stress reactions, how our mind and our body and our behaviors respond in those moments when we are activated or surprised or challenged by something. And so while we might not be able to do much about the event itself, we can begin to develop a range of techniques that anticipate those. And should something come up, we can begin to employ different strategies so we don't feel overwhelmed or incapacitated by things that we are confronted with. So as psychologists, we try to tell people we may not always be able to predict stressors day to day, but what we can do every day is take those baby steps to develop our toolkits around how we're going to care for ourselves should something come up. So we want to focus on that stress reaction. If we can go to the next slide. Now, what happens when we're stressed? And bear with me as we just get into a little bit of the psychology and the neuroscience of what happens to our bodies and our minds when we're exposed to something that might feel dangerous or worrisome or challenging or threatening. All of us at some point, big or small, are faced with things that kind of begin to change the physiology of our body. Now, one of the things that we've all probably experienced is what we call the fight, flight, or freeze response. That is when we are exposed to something that we perceive as dangerous or threatening or challenging. Even before we are consciously or aware of it, our body begins to prepare itself for either running away or hiding or kicking into action. This is all incredibly normal. When your body does this, it is connected to these very deeply hardwired responses that, quite frankly, have been important, for the survival of our species and other species. If you see something dangerous, you might want to run away as fast as possible. So your pupils dilate. You don't really want to eat at that moment, so your stomach shrinks. You have blood pumping to certain organs of your body. I know this can sometimes feel unsettling, but I just want people to kind of take a moment or a breath next time that happens and remind yourself, this is actually your body functioning the way it should. If we can go to the next slide. But here's the thing, and I love showing this picture of zebras. If you're looking for a book over the winter to read about stress and how it impacts our bodies, I highly recommend a book by Dr. Robert Sapolsky, who is a neurobiologist at Stanford University. Dr. Sapolsky says that zebras, like people, when they are in a situation of danger, if they're being chased by a lion, let's say, their fight-flight response is in high gear. Their blood is pumping as hard as it can to help them run away and keep them safe. The thing about zebras, however, is that when the chase is over, if they survive, that physiological response, that cascade that allowed them to run very fast, it comes back down to baseline very, very quickly. And they go back to doing what zebras typically do. Now, people, on the other hand, we have these amazing brains that allow us to do very, very sophisticated things, but they also enable us to worry a lot. So even in the absence of immediate stress and immediate danger, we can remember things, imagine things that keep that fight-flight response elevated for long periods of time. If you can take one thing away from my lecture tonight, it's maybe we should all be a little bit more like zebras. And so, it's not that we can always prepare ourselves for danger or difficulty, but hopefully we can develop skills that will allow us to get back down to that baseline as soon as we can, so we can focus on those things that we want to be focused on and not feel so overwhelmed, which ultimately will have protective factors for our heart and our body. If we can go to the next slide, please. I also just want to recognize that it's not just the sort of single things that come at us day to day, but for many individuals, there are cumulative stressors that are impacting us, whether it's around economics or housing or caregiving or organizational structures or more systemic challenges that people face. But I put that out there because I think it underscores the need for these preventative and integrative strategies. Everyone experiences challenges and stresses differently, but I think it's fair to say that given all of the things that people are trying to kind of hold and navigate these days, it's important to take a little bit of time every day to think about your care and to think about simple things that you can do to reduce those stress levels, given the complexities that people are facing. If we can go to the next slide, please. So just a quick mental health 101. How do you know if you're really experiencing a lot of stress that might be manifesting in mental health symptoms? If we can go to the next slide, please. So there's no one single symptom I would say you should be on the lookout for, but you want to be thinking about that triad of sort of behavioral changes, emotional changes, and physical changes. Are you thinking in less positive ways? Are you having a harder time enjoying things and not experiencing positive emotion? Are you noticing, changes in your appetite? Are you moving differently, sleeping differently? Now, of course, any one of these things alone doesn't mean that you're overwhelmed with stress or experiencing a mental health issue. But if you start to notice that these things are persisting for a couple of weeks and are a big change in how you typically experience yourself, it would be at that point that I would recommend reaching out to your doctor or a mental health professional just to find out a little bit more about what you're experiencing and what kind of care might be available. If we can go to the next slide. And another one, and I just want to mention that because these have been particularly challenging times around COVID, but also sometimes people are going through personal events that can be very stressful. In addition to those symptoms that I just mentioned, sometimes people actually do experience what we call post-traumatic stress, where they might have memories or nightmares or difficulty sleeping because of bigger events that they've been through. The thing that I just want to underscore is that NYU Langone Health is one of the leading centers in the world around both the treatment of anxiety and depression, but also post-traumatic stress. So if people do have questions, and again, you can reach out to me on the side about where to get care, what kind of care is available. These things can feel very unsettling and scary at times. But the good news is that we also do have a lot of excellent treatments to help alleviate a lot of that distress. If we can please go to the next slide. Now, I'm just going to go a little bit more deeply into how this works, and then we're going to connect it to things like mindfulness and yoga. So actually, at our other part of NYU, at the downtown campus, there are some world-renowned experts who've been studying what happens to organisms when they are exposed to things like shocks and different kinds of challenges to understand the fear circuitry in the brain. And we know that there's this small part of the brain called the amygdala that gets activated when people, rats, monkeys, dogs are exposed to some kind of stress, which triggers that flight-fight response. And if we can go to the next slide. But again, the interesting thing about people is that when we are feeling all of those things, we can actually rely on certain parts of our brain to down-regulate those responses. What we have in our brain are actually called inhibitory neurons, and we have these cognitive structures that if you see something that you think is scary, but you know it's not dangerous, we, for example, engage the newest part of our brain called the prefrontal cortex to bring those stress levels down. Think about the last time maybe you were sitting on a couch watching a scary movie and you felt your heart rate go up. At that moment, you tell yourself, oh, it's just a movie and I'm actually safe. If I had an MRI on your brain at that moment, that reappraisal, that re-understanding would engage that prefrontal part of your brain, which is so important for being more like zebras, where we can very quickly come back down to that baseline. So what we really want is to help people develop practices and develop strategies that tap into our prefrontal cortex. We can go to the next slide. This is what I would call fundamentally the concept of resilience. If we can go to the next slide. Resilience is not the absence of feeling things. It doesn't mean that you go through life smiling no matter what you face or what you encounter. Resilience is the very simple notion. It recognizes that people go through adversity, that people live through incredibly difficult times. But remarkably, the majority of populations, despite how hard these events are, they find ways to keep going. They find ways to cope, to stay connected to people and activities and their work that they care about. And while they might be profoundly changed as a result of these experiences, they are able to function at the same levels they were before, or sometimes even at elevated levels where people talk about feeling more empathic and more compassionate for others who've suffered. So of course, there are people who struggle with mental health issues after they experience a lot of stress. But I also think it's important to remember that if we develop some of the strategies we're going to talk about tonight, we can nurture a sense of resilience and enhance our coping skills if and when we are faced with certain challenges. If we can go to the next slide, please. And so I would say since 9/11, so, a few decades now, there has been systematic research globally on populations that have been exposed to very significant traumatic events, very large epidemiological studies. And again, we find that even in the hardest of moments and contexts, about 50 to 80% of people, without specialized care and medication will find ways to remain resilient if they are able to continue working, stay connected to loved ones, are committed to ideas that they, believe in and have some of those key supports in place. And again, there is a number of people, a significant minority, who will need additional supports. Another sort of public health message I hope to impart tonight is that, if someone or if you are ever in a situation where you go through a difficult event and you are experiencing, chronic stress, or you begin to develop a mental health issue, there is no shame. There is nothing wrong with seeking specialized care. And in fact, the sooner you can get that care, the better the prognosis, the fewer relapses, whether it's anxiety or depression or other mental health issues. But we really need to break down some of those barriers that exist. If we can go to the next slide. Now, there are many, many factors that can build resilience, and we're just going to focus on a couple tonight, one being mindfulness and another being yoga. So we can go to the next slide. What is mindfulness? Many of you probably know this term very simply. It's the idea of breathing and paying attention in the present without thinking about the past or the future, being aware of your thoughts and feelings in a non-judgmental way. Very simple. If we can go to the next slide. So there's a few components. Again, switching, and this is very hard for me, especially as a busy New Yorker, of going from a mode of doing, do all day long, lots of tasks, to a mode of just being and just sitting and just breathing without judgment. And I know for some of you in the audience tonight, this might sound like the worst possible thing I could ask you to do, because your mind immediately becomes aware of all of your thoughts. What I'd like to just underscore is the importance of baby steps. If you've never done a mindfulness practice, you don't have to start doing this for hours a day. We're talking just a few minutes a day to begin to introduce you to these kinds of practices. If we can go to the next slide. So is it good for your heart? That's why we're here, right? So what's the point of doing this? So there's some really interesting research that is emerging, and I'm not going to lie, it's still rather new. It's an exciting field. We can go to the next slide, where people are starting to research this carefully. And this is why we think it is so important. We know that meditation focuses attention. We know it helps people to regulate their emotion, and we know it brings more self-awareness to what we're doing. All of those things together enable us to have greater self-regulation, which in turn will be good for preventative strategies around heart health. So whether that is better impulse control, motivating us to get more exercise, resisting some kinds of things that may not be particularly good for our health, there's still questions about the direct relationships between meditation and heart health. But I think it is fair to say that indirectly through these other pathways, when we become better at, having greater impulse control, we have more attention, more self-awareness, we are more likely to make better decisions that are aligned with those different pegs on a stool that the doctor was talking about before. So we can go to the next slide. So here's just a couple of data points to take away with you. People who are more mindful, even without doing meditation, people who just score higher on mindfulness traits, they tend to have better heart health, which is some good indirect data and evidence that this might be a good thing. If we can go to the next slide. But when we actually look at interventions where we teach people to do mindfulness activity, we see that it does reduce smoking. We see that it helps with caloric intake, especially in higher risk populations. And we've also seen overall, it can help with blood pressure as well. Now, not getting too much into the statistics here, the effect sizes vary. The power of this does vary study to study. So I wouldn't rely on mindfulness alone as the only thing you're doing, but I would say consider adding it to the overall strategies that you incorporate into your healthy lifestyle as one of the things that you draw on. If we can go on to the next slide. What is mindfulness? So it is not a passive state. It's not zoning out. It's not escapism or avoidance. It really is, and if we can go to the next slide, it's really about being present. It's not being on autopilot. It's actually developing an awareness, a focused, deliberate attention, but without judgment and without self-criticism. I think why mindfulness can be so hard is because really it is that moment where you begin to develop an awareness that you realize how self-critical we can be and how hard on ourselves we often are with that inner voice. But it's also the opportunity where we can begin to change that. If we can go to the next slide. So when we think about mindfulness, what we teach is to really think about not being judgmental, to just acknowledge without changing, to have compassion for oneself. And I will say over the course of the pandemic, I've worked with so many people who kept saying, you know, Adam, I should be doing this. I should be doing that. I want to be a better parent. I want to be a better worker. And I should be exercising. I should be, and all these shoulds flying around. And I would just ask people to just take some moments every day to just bring some self-compassion and awareness of everything that you are doing. And yes, continue to strive for improvement, but we also need to balance that with acceptance and having this beginner's mind, this sort of childlike curiosity about what it's like to just be in the present and not try to bring all of our baggage to that every time, we're doing something. If we can go to the next slide. So there's different ways that we can engage in mindfulness practices. Some are formal, probably the ones that you might be thinking of, like meditation. It could even be mindful walking, just going to your local park. But it also could be kind of integrated into other things that you do every day, like maybe while you're commuting, if you're breathing a little bit, or if you think about the way that you're eating rather than just, finishing your meal as quickly as possible to get to the next thing. Or maybe you're doing some leisure chores or some chores around the house. And while you're doing that, maybe you're listening to something that helps you with a guided meditation, or you're just becoming more aware of your breathing and whether or not it's slow, and are you breathing through your belly and things like that, and we can come back to that. If we can go to the next slide, please. So let's talk about some very simple things. Now, you're all probably familiar with the concept of 10,000 steps. So I want everyone to think about these being like, how do we get to your 10,000 mindfulness steps a day? Which I just mean by, let's find a few things that you can do every day for just a couple of minutes that brings your attention to the present, engages your breathing more slowly, and kind of takes you out of that doing mindset into more of a being mindset. So the simplest one is stop. If you're working on something, you're in a situation that's making you feel stressed, just stop for a second if you can. You're going to take a breath, observe what's around you, and then proceed. But in that moment where you observe and then you proceed, you've created a little bit of space where you decide how to take that next step. And in mindfulness, that's important because you have the control over the situation as opposed to the situation controlling you and your emotions. And it takes 1 second to do, and it's very easy to practice. If we can go to the next slide. Like I said, mindful eating. So again, if you're rushing between meetings or you've got something else to do, I'm guilty of this as well. Sometimes, a meal is just a means to an end so I can get back to doing some work or some kind of task. Whenever you can find a little bit of space to just think about what it tastes like, what is your sensory experience, slowing down, breathing a little bit between bites. Not only will you probably enjoy your food a little bit more, your digestive system will probably thank you for it, but it also is a really easy way to integrate mindfulness into another, informal part of your day-to-day routines. If we can go to the next slide. Let's talk about some very simple breathing techniques. Now, a lot of us, if we can go to the next slide from there, are often kind of breathing from our chest, and it's very common, but that's not necessarily going to help with our stress levels. So we want to really breathe from our diaphragm. We want to breathe from our bellies to have that physiological change, to engage the parasympathetic nervous system. So we can do a few things. If we go to the next slide, I'm going to teach you some really, really simple breathing strategies. I love this one. Just put one hand on your abdomen, the other one on your chest, and then just slowly breathe in through your nose. And then you're going to feel your belly begin to expand. You're going to relax your face, and then you're going to release. Sometimes it helps to visualize tension actually leaving your body, and kind of takes you out of your mind a little bit and really keeps you in the present. If we can go to the next slide. I personally love this one. I am someone who thinks a lot, so I often have like to-do lists and other things that are circulating in mind. So for me to quiet that a little bit, I like to count while I breathe. So I like the 4-1-4 technique, which is also called the box technique. A lot of this was actually developed with military folks who are under enormous amounts of pressure to help them stay calm and not feel overwhelmed. Very simply, you breathe in through your belly for 4 seconds, hold it for 1 second, and then exhale for 4 seconds. 1 minute of this, 2 minutes of this. It's almost hard to stay as anxious and stressed and as worried after just a couple of repetitions. Now, of course, if you have any medical conditions or concerns about doing deep breathing exercises, absolutely consult your doctor before doing them. But if you do get the go-ahead, the 4-1-4 technique is extremely easy to do. If we can go to the next slide. I also like this one, just the relaxing sigh. If you can just stand up, straight, take that deep breath in, and then you just exhale and actually let it out. Now, many of you might be in New York City. You might be zooming in from other places. But if you are in New York, maybe you live in a small apartment with neighbors all around you. So I don't know if you can make a very loud sigh. But if you are in a place where you can, just that physical vocalization of the sigh with that deep breath is a great way to just very quickly release that stress and tension that maybe you've been holding on to all day. I might try this, if you are feeling that way, right before bed. Just, let it out. Next day will bring new things, new opportunities. But right now, we're just going to relax with that sigh and let it go. If we can go to the next slide. I really like this one as well. A lot of people tell me that this helps them, again, bring them into the present and has a very quick action in terms of bringing them that stress release. This is called alternative breathing, where you're sitting in a comfortable posture and you actually use your nostrils. I know this seems a little silly, but it works very effectively, where you actually alternate between your right and your left nostril in terms of breathing in, inhaling, and then exhaling. So you might breathe in through one nostril and then exhale through the other one. And again, for some people, they find that this technique really allows them to feel more relaxed. And I guess part of what I'm suggesting is you can pick a few, you can practice a few, you don't have to commit yourself to one, but just, give a few of these strategies a try and see which one is most comfortable for you. If you can go to the next slide, please. I also like the ocean breath. This one can sound a little funny too. So you might want to be, doing this in a room by yourself. But here you're inhaling and exhaling deeply through your mouth. And while you are, you kind of get this little bit of a tone in the back of your throat, almost like imagine that you're fogging up a pair of glasses and your breath sounds like ocean waves when so it's a deep breath in. I'm not going to make the noise on this. I know it's going to be on YouTube and watched by thousands of people. But if you want to give this a try, you just take a deep breath in through your nose and then hold it for a second and then exhale. And again, I think for some people who are a little bit more caught up in their mind, these, I would say, almost like more body-based strategies or counting, they really help to kind of take you out of all of those ruminative thoughts and bring you into this work of mindfulness. If we can go to the next slide. Now, a very close relative of mindfulness is one of my favorites. It's called progressive muscle relaxation. And again, for people who struggle with a lot of negative thoughts, this really allows you to do a mindfulness practice that's really based in the body and the muscles, and it's extremely relaxing, and it's not too difficult to do. So, and there's a good evidence base that while, again, this alone is not going to cure, every ache and pain and issue, it can be a useful adjunctive intervention to other things that you might be doing and a good preventative strategy. So if you go to the next slide, how do you do progressive muscle relaxation? Some of you may have tried this already. You're essentially just systematically tensing and relaxing muscles throughout your body and breathing the whole time. So you might lay down on a bed, you might be sitting in a chair, tense up your fists, hold it for a few seconds, release for 20 to 30 seconds, breathing the whole time. Then you might go to like your forearms or your shoulders, tensing those up, holding that for a few seconds, releasing for 20 to 30. And then you're doing a body scan where you go through, from like the top of your body all the way down to the bottom. You could also start with your toes, work your way up. And again, you tense, you hold, and then you just release. This can feel really great right before bed. If you've just been on email, if you were just streaming something on Netflix and your mind is in a lot of places and you need to go to sleep, try a few minutes of progressive muscle relaxation. It could be a really great way to just center you and help you get, into that sleep mode. Again, if you are experiencing any kind of physical pain, if you're managing, physical issues, talk to your doctor before you start this routine. But again, if you get the go ahead, give this a try. It's very relaxing, very easy to do. If we can go to the next slide. So we talked a lot about mindfulness. Hopefully I've convinced you that it's a good thing for your heart, especially for preventative strategies. But what about yoga? What is yoga? Yoga is an ancient Indian practice that involves a variety of postures, breathing control, and also incorporates meditations. You kind of get both at the same time. It was founded in India 5,000 years ago, and it was really believed to be the sort of integration of mind, body, and spirit, and it has different forms as well. If anyone has done yoga here, there's not one type of yoga, but there are various forms of yoga that people can do. If we can go to the next slide. There's some pretty good evidence. Again, this is a newer evidence base. People are really starting to study this very carefully, and it's growing, especially with regard to cardiovascular prevention and heart health. But there was a fairly recent, what we call meta-analysis done, where they looked at 37 randomized controlled trials around yoga to promote heart health. Overall, the evidence is pretty good. It seemed to help with body mass index, blood pressure, lipids, cholesterol, heart rate, triglycerides. The one thing I want to say, though, for the scientists out there, is that this was when yoga was controlled compared to people not doing any exercise. When yoga was compared to people doing other exercise, like biking or running or other things, we didn't see many differences statistically. Which is just to say that if you're not doing anything and you're leading a pretty sedentary lifestyle and you're interested in yoga, go for it. It seems to have a lot of these benefits. Whether or not yoga would have additive benefits on top of other exercises in terms of your heart, we're still learning about that. But by and large, if you are physically able to do it and you're doing it in a way that's not straining you and adding more, pressure to your body, and there are simple ways that you can do yoga, then it does seem to be a really wonderful form of exercise. But I wouldn't necessarily say at this point it's better than other exercises, but it's something in your exercise tool belt that you would want to think about. If we can go to the next slide, please. Now, for those of you who are new to yoga, or maybe for those of you whose mobility might be, a little bit limited, or, you're not as flexible as maybe you could be or will be in the future after you're doing more yoga, a really simple place to start is right in your chair, what we call gentle seated yoga. And if you are like me, and sometimes you spend a lot of your time on Zoom calls, writing papers, on the computer, you could just take a few minute break and do yoga right there. You don't necessarily have to go to a yoga studio to do it. If we can go to the next slide, I'll just show you an example. Very simple postures. You can YouTube, if you just go to YouTube or Google and look up, seated yoga, there are some really simple demonstrations. But for me, this is the gateway. This is the entry point for people who've never done yoga before, where you can just do very gentle stretches in different ways to keep your body limber and to also begin to integrate some of that mindfulness technique into the moment. If we can go to the next slide. A few things I just want to touch on quickly, and then we can go to questions, is a part of, I think, both yoga and mindfulness is the use of visualization techniques. We know that the brain circuitry for vision is deeply connected to our stress and fear systems. If you are the kind of person who likes to visualize things, whether it's a place that's comforting, a place that brings you joy or happiness or a good memory, think about incorporating that into maybe a little bit of mindfulness, just really picturing something that is meaningful to you, because we know it's not just the breathing, but actually the visualization itself, which could lower some of those stress responses. And then finally, I'll just say that when it comes to meditation and mindfulness, I'm pretty open in terms of what people do if they find an activity that allows them to be in a state of what psychologists like to call flow, F-L-O-W. That is an activity where you are immersed in doing something, maybe something creative, oftentimes with other people, where you feel challenged and intellectually stimulated, but not overwhelmed. In my opinion, all of those kinds of activities often have a meditative-like quality to them. So if the breathing or yoga at this point feels a little overwhelming, it's not exactly what you're looking for, learning, an instrument, doing art, spending time in nature, what some people call nature bathing, but just really spending some time outside, maybe even something like aromatherapy or spirituality. A lot of these things, these activities provide very meditative-like, mindfulness-like experiences. Again, you don't have to dedicate hours a day to these things. I will push you, encourage you, aim for 12 to 15 minutes a day for any of these activities and see how you feel. If we can go to the next, I would also say that unfortunately, our mental health plans, our wellness plans are often the last thing on our to-do list every day, but let's try to bump that up to the top. Where in your schedule are you going to block off that 15 minutes? What are you going to do? And can we try to stick with it? And we can talk another time about how to stick to those goals. That's another challenge. But as the new year is approaching and people are thinking about resolutions, maybe we can even think about meditation and mindfulness as one of them. If we can go to the last slide. Thank you all for having me tonight. It's an honor to be here. And thank you for the people who organized this very important public health service for the greater community online. And if you want to talk or make an appointment to do some of this work, please reach out to me at adam.brown@nyumc.org, and I would love to hear from you. And I will turn it back over to the organizers.
Adam, thank you very much, Dr. Brown. That was absolutely superb. I love the way you kept it practical and you gave people so many ideas on very simple ways and techniques that you can manage your stress. And we all have stress during the day. There were one or two things that came across my mind while I was listening intently to your talk. And one was a definition that I once heard from a wonderful friend of mine who said that stress is the subjective sensation of an inability to cope. And in many ways, that's so true, because one person's stress is not another person's stress. And I think we have to be very sensitive to other people. And if they tell you that something's making them anxious, like heights or flying on a plane, you shouldn't say, well, what are you worried about? Because you don't have that same stress. So I think that's one good way to start feeling at least sensitive to other people's stresses and help them deal with them that way. The other thing I wanted to mention is really validate something you said, that one of the most important ways to minimize and reduce stress is to keep connected to other people and keep connected to your family, to your friends and community. There's so many opportunities to be involved with community. It's really wonderful if you have a religious community, whether it's going to the church, the synagogue, the temple, or the mosque. And that's always a wonderful way to meet people and to do things for other people through your religious community. And that's also a wonderful way to reduce stress. I'm going to take some question and answers from Dr. Brown. And then just to reiterate that if I don't get to your question, please email him or get in touch with him, as he's only too happy to be of help. The first one is, can I relieve stress via breathing? How do I slow my breath down when I'm stressed? So Adam, I think you did address that very well about relieving stress with breathing, but I'm going to let you take this question again.
Yes, and I think I did, speak to this, but I will just say that if you feel like you're hyperventilating or you're very anxious and it's hard to slow your breathing down, I would say take a glass of water, find a comfortable place to sit, put your hands on your body, feel your belly, and then just slowly try to breathe for a couple of seconds in a way that's really expanding your stomach, as you're inhaling, and then feel that, exhale go out. And the other thing I would say is that, we often start doing these things when we are in crisis. If you're not in crisis, if you're not feeling stress, now is a great time to practice these things. So when you are feeling stress, it's like a memory muscle. You're quicker to do it, and you can bring down your stress levels even faster because you're already used to doing those kinds of breathing techniques. So I would, again, it's the preventative approach of a few minutes every day of getting used to this type of breathing.
Okay, that's great. Can yoga improve my back pain?
I think there's a lot of good evidence for yoga and for mindfulness meditation to help with chronic pain, including back pain. The only caveat, the only thing I would say to that is because pain can be very complex to manage and to understand, I would always consult your physician or your care team before making any changes or starting new routines. But, should they feel that yoga or meditation is a potentially helpful part of your treatment planning? Absolutely. Yoga can be very helpful in that overall approach to treating pain, including back pain.
I've had many patients who've said that yoga really helped them. And I think what it does is that, when you have a good yoga teacher and you do the stretching, which is so much part of yoga, and take away so much pressure from the back and the nerves that are being, pinched sometimes. So it can be very helpful, but it needs to be done carefully. If you have back pain, always have it evaluated first by a physician or a caregiver to make sure that they get to what the cause of the back pain is, and then ask whether or not it's safe for you to do yoga. Next question. How do you start a habit of yoga or meditation when you're already stressed with time and you don't have enough time to do anything or everything? I guess it's a typical, very common scenario. People must say, I don't have time for it. And I know, and that the only way to do this is to make sure that you find time for it, and then you'll realize how
and there's something a little bit magical about yoga and meditation in that it does help with concentration and attention. So if you are starting to do a meditation practice, maybe in the morning or in the afternoon, you might actually find that it helps your efficiency with other tasks in a way. So you might find that as you begin to squeeze this in a little bit, you actually spend less time on other things that you're typically doing. And I also think it's important, right, for us all to take the long view, in that we're not only thinking about the day-to-day tasks that we're doing, but what do we think, how are we thinking about our healthy lifestyles over the long term? And this is an investment in you. This is an investment in your health. And so, again, 10 minutes a day, 12 minutes a day. I know it's not easy, but baby steps. Let's try to integrate this, into our lifestyles.
Next one. What is the opposite of mindfulness? Binge watching TV or cable news? And while you're answering that, I got a question from one of our regular attenders, Stephen Ho, who asks many questions. I'm going to try to get to some of them. But he also asked the question, well, how can you be mindful while you're doing house chores? Or is it, do you have to be mindful sitting quietly, separately, or is it something that you're doing while you're doing other things during the day?
I think you can be mindful while doing certain activities. So whether it's doing a chore, taking a walk, and I think what it really is about is bringing attention to the present and really not trying to worry too much about the future or remembering things in the past, but just really focusing on what it is you're doing. I'm very impressed that people may have not watched all of the World Cup to attend this today. But if you think about those players, for example, when they're on the field, they are probably in a state of mindfulness where they are fully present in that moment, really aware of their body, really aware of that situation, and not, in the future or in the past. And to me, that is one form of mindfulness where you can just be more aware of your body and what you're doing in that moment. But so many of us, because we're juggling so many things, we're actually not dealing with what's in front of us. We're so caught up in our minds and our worries and our, and the things that we're ruminating about. Is the opposite of mindfulness binge watching TV and cable news? It can be, I think where we're not really paying attention and we're just kind of passively taking information in. Sometimes that's all you've got at the end of the day. You just need to sit and relax and pause for a minute. So no judgment there, but you also just want to balance that out, that's not the only way you want to cope with stress. You want to develop other healthy habits as well. And I think mindfulness is, one of those that we're talking about.
Excellent. Could you give us your email one more time, because there are people that are asking me
Yeah,
for it.
absolutely. If I put it in the chat, Dr. Goodman, will people get that, or should I just say it out loud?
If you put it in the Q&A and you say it out loud, then Anya will. There it is. Anya's put the slide up.
Okay, perfect. Go team.
So adam.brown@nyumc.org. You mentioned a book by Dr. Sapolsky. What's the name of that book?
I love this title. It's called Why Zebras Don't Get Ulcers. Why Zebras Don't Get Ulcers.
Right. Okay, we look forward to reading that. So I've got one or two questions here from Stephen. And if we don't get to all your questions, Stephen, please email Adam. I'm sure he'll be delighted to chat with you and to get to know with you. One of the questions was, what is your view on acupuncture for stress management? There's no question in my mind that there's some good evidence that it helps. And I've had patients where it helps, but what's your experience?
My experience is the same. I mean, look, no treatment is going to help every single person. I wish it would, but I have seen with some individuals, and I wish I had a better understanding of the pathophysiology of why acupuncture is so beneficial from some people. But I have seen in certain clients where they've been struggling with chronic pain and anxiety for long periods of time, and then they start acupuncture, and it really helps. I would say that I think a lot of those individuals are also doing other things to complement acupuncture, but it seemed to me that from those case studies that acupuncture was very effective. And I think the scientific evidence base looking at randomized control trials are beginning to really support that. So I'm in favor of it. Again, I wish it was a cure-all. It's not, but I think for certain conditions, certain individuals, it does seem to be helpful.
And another question, does religion help resilience? Is there any evidence that in part, he also asked the question about that walk in a park in part helps to due to infrared reflections from the sunlight from the trees or negative ions from the trees. I mean, I think this is getting into why is it helpful just to take a walk in the park? And what about the sun's rays and there's the zeta potential from the earth if you're actually walking bare feet. These are all things that are helpful. But just getting out there and breathing fresh air and doing the kind of breathing you're talking about while you're really exercising is a wonderful, wonderful thing to do for stress management.
And I know I kind of said it as an aside, but for people interested in it, it developed, I believe, out of Japan, where a lot of this work is taking place. There is a concept called nature bathing. It sounds, more provocative than it is, but it really is just the idea of going to your local park or, botanical gardens and just taking a walk and just really being focused on the nature around you. And not surprisingly, when, they monitor people with heart rate and, other kinds of physiological markers, they really see people's stress levels come way down after a few minutes. And it's as simple as just taking a walk, breathing, and really paying attention to the kinds of natural things that you're seeing around you. And it doesn't have to be Central Park. I think it could even be your local neighborhood park if that's what you have access to a few minutes a day. And I do think there's a pretty good evidence base there.
Any concern about ocean breathing? Could it trigger increased vagal tone, Valsalva? I don't think that that's really what's going to happen if you do it properly, because you're not holding your breath.
That's right. That's
Actually, you're actually breathing. You're breathing in and out.
That's right.
So one last question that I have for you is, I saw it over here. Oh, are there any supplements that help with anxiety and stress? I can mention two, but I don't know whether you use them or whether you'd like me to do that.
I'll turn that, if that's okay, Dr. Goodman, I'll turn those over to you.
No. So, there is chamomile, can be very helpful. It's very relaxing. And it's a tea. And there's also a product called ashwagandha, which is something that can be it's called an adaptogen. It helps with resilience. You should definitely discuss it with your physician. You can read about it. The dose is about 450 milligrams 2 or 3 times a day. And for some people, it really helps to relieve stress. So I think we're going to leave it there. Dr. Brown, you were terrific. I think we've got a lot of work to do together, because I think we're both on the same page. And I can't stress enough to people how important it is to pay attention to your stress levels and try to bring them down, because there is the higher the stress level, the higher you have chronic high levels of catecholamine, the more that you increase your risk for chronic conditions, including, having heart attacks and strokes. So that's why I asked Dr. Brown to speak. You did a fabulous job. We really appreciate your time. Thank you all for joining us. Here's our contact again, hearthealth@nyulangone.org. And there's our website, nyulangone.org/hearthealthlectures. Adam, why don't you give your email so I don't get it wrong? And then I'll...
Sure. It's one more time. It's Adam, ADAM, .Brown, like the color, and then at NYUMC, like medical center, NYUMC.org.
Good. Thank you. So I want to wish you all a happy holiday season. Be well, be safe, be in touch, get in touch with people that may not have somewhere to go. Invite them over to join you. Keep connected with community and enjoy your family and friends. Thank you. And of course, before I end off, Anya, thank you so much. So wonderful to have you, and I really appreciate your help. Thanks, Anya, and thanks, Adam.